So thank you, Rick, for inviting me to this very interesting webinar. My name is Josep Vidal-Alaball, and I'm a rural GP. And at the moment, I'm combining clinical practice with research and teaching at the university. Uh, Today, I want to tell you my story with the story of my team with telemedicine during the last 14 years that I have been involved in research regarding telemedicine. I did my PhD a few years ago and I've been researching since then. And basically, I will explain my experience before the pandemic, during the pandemic of COVID, and then some thoughts about how maybe the telemedicine will evolve in the next years. For many years, for 10 long years, I felt like preaching in the desert actually because I was researching and I was trying to implement telemedicine here in Catalonia, and it was quite difficult. So my pre-pandemic experience basically started in 2010, and we started developing some telemedicine programs in central Catalonia. Actually, we managed to develop teledermatology, teleulcers, teleaudiometries, and also telepsychiatry. But actually, although they were very successful, and even we managed to reduce the waiting list in dermatology, for instance, we couldn't manage to get to pass Central Catalonia. We couldn't implement these programs any further than in our local region. Again, we did another study. We demonstrated that it was cost effective, that actually the telemedicine, the teledermatology and the telemedicine programs, they could save 15 euros per visit. And they were especially good in rural areas because we live in a rural area. So the people in rural areas, they were quite keen and to use the telemedicine services. Again, we didn't manage to get past our region. This another study we did showing that it was most useful in rural areas. And again, as I said, we kept publishing and demonstrating that telemedicine was useful. But suddenly the COVID came and then everything changed. And actually from one day to another, as in many other places, primary care centers were closed, and we just had to do non face-to-face visits. We have to just to use telemedicine. Actually, really, we use telephone medicine more than telemedicine, but well, also we had some we call tasks, some virtual visits, and I will explain a bit later. We use it e-consultation that were very useful, and also we start using video consultations with not such a success. Again, as I'm sure in many other places in Europe, uh, during the pandemic, of course, all the face-to-face visits were restricted. So we had a huge increase in telemedicine, telephone medicine, and e-consultations. The thing what's really a success was the e-consultations, but because they were already in place because these e-consultations they started in 2015 and 2017, so we knew the e-consultations and they were quite good because they were integrated with electronic medical records, and actually they are integrated with our daily list, so you get an appointment to reply to these consultations. And before the pandemic was already growing, and more people and GPs were using, and then also it could be used by nurses and midwives. But of course, during the pandemic, the use of the consultations increases exponentially. Well, you can see, you can imagine that everybody had to use a consultation. So actually, I think at the moment we are counting last week, and there have been about 40 million of e-consultations in Catalonia. And the type of why people were using e-consultations before the pandemic mainly were for management of their results, also for sick notes, to ask for referrals or visits for repeat prescription, also some clinical queries. But during the COVID, they were mainly used for the sick notes because all the sick notes were sent by consultations, of course, for repeat prescription and also for some clinical queries. I told you about video consultations. We were very enthusiastic about this, and this is my first video consultation. I was quite happy, as you can see, but they were not really a success. We had problems because we realized that they didn't offer us more than a telephone call. They were not linked to the electronic or medical notes like the consultations. There were a lot of technical difficulties for patients because they have to give access to the microphone, to the camera. If they didn't do it, then it was a problem. And for people with low IT skills, they were quite complicated. And also, we live in a rural area and we don't have fast broadband everywhere. So it was a huge disappointment, but I stopped using video consultation because it wasn't offering me anything special, and it was not just me. Uh, there are very few GPs who are using video consultations. But during the pandemic, some of us, we start thinking about this telemedicine. I mean, I was happy because after 10 years, everybody was using telemedicine or telephone medicine, but we start wondering if maybe we could have gone too far because we realized that maybe because we're giving such an easy access, we're getting thousands of consultations. People were using a consultation for very banal clinical problems, and especially the young, they were using consultations very easily. So we start wondering if maybe this was too much. And also we realized that some, as I said, the young, they were using a consultation, and sometimes was much easier for them to get an appointment using the consultation than the elderly doing a face-to-face visit. And we also had some problem with the professionals because I don't know if you have noticed it, but some of the professionals, they seem happy to not to see patients face to face, and they were just closing in the surgery and just seeing patients through the telephone. And of course, this was not good. But some of the GPs, I'm sure it was the same in other countries that patients were complaining that they couldn't get to their GPs. And also we start worrying because we thought maybe that the government would think that, well, this is telemedicine could be a cheap alternative to face-to-face care. So we wanted to demonstrate that maybe we had to find the right place for telemedicine. So we started doing what we do. We did some research, and the first thing we check, because we were checking how the pandemic affected the diabetes management, and of course affected badly because patients during the pandemic they had less controls and they have worse glycemic control. But then we also realized that the practices who were offering less face-to-face appointments, they have worse indicators of diabetic control. And then we started saying, well, I think we need to restore the face-to-face visit as soon as possible, at least for these with patients with chronic conditions. And just recently, last year, we also look at again the increase of the prevalence of depression and mood disorders in Catalonia before and after, during and after the pandemic. And during this time, we also found that, of course, the health consultations increased a lot. But the worrying findings that we had is that first of all, we realized again that men and younger individuals, they were more likely to use e-health, and I think this is expected. But also we found that the e-health consultations were associated with higher use of antidepressants and anxiolytics. So if you were using e-health, you were more likely to get a prescription of antidepressant of anxiolytics. So to finish, uh, I want just to leave you with some thoughts after 14 years of researching in telemedicine, and I think this could be a good start for a debate. I mean, there's no doubt that telemedicine has a great potential to improve patient care, and especially in rural and isolated settings. But well, it has to be clear that it's a medical act and it has to be accepted by the patients. So we need the patients to get involved in that. And of course, as is another type of visit, it has to guarantee the patient's right to autonomy, professional secrecy, protection of health data, privacy, and confidentiality. And as uh, I see the telemedicine as another type of visits. You can decide if you want to do a face-to-face visit or you want to do a telephone, a house visit, or a telemedicine. But it's just another type of visit that you can adapt to the patient or to the professional. And yes, for me, it's very clear that the telemedicine shouldn't be an excuse to offer inferior healthcare. And of course, it shouldn't not be used by governments to cut healthcare services, especially please in rural areas like mine. Thank you very much.